Hello, I am Julie Grace Ramel Mejia, a registered nurse here in Arizona. Welcome to this presentation on IV insertion and its complications. In this video, we'll cover the basics of IV insertion, common complications that can arise, and how to prevent and manage them. Here are 5 clear and concise learning objectives of an IV insertion training session. Number 1. Understand the purpose and indications for IV insertion. Learners will be able to identify the reasons why IV insertion is performed, such as medication administration, fluid therapy, or blood transfusion. Number 2 is to demonstrate proper technique for IV insertion. Learners will be able to perform step-by-step process of inserting an IV catheter, including preparing the site, choosing the appropriate vein, and ensuring proper placement. Number 3 is to identify and manage common complications of IV insertion. Learners will be able to recognize complications such as infiltration, phlebitis, infection, and air embolism, and describe appropriate response to each. Number 4 is to ensure patient safety and comfort during IV insertion process. Learners will be able to apply techniques to minimize patient discomfort, ensure sterility, and reduce the risk of infection. And lastly, is to implement strategies for preventing IV-related complications. Learners will understand how to prevent complications by selecting the right catheter, monitoring the site, and following proper infection control procedures. So let's begin. What is IV insertion? IV insertion involves placing a needle or catheter into a vein to deliver fluids, medications, or even blood. It is a common procedure in healthcare used to provide treatments such as hydration, pain relief, antibiotics, or blood transfusions. Understanding the process and its risk is crucial for both healthcare providers and patients. The most common sites for IV insertion are the veins in the arm and hand. Veins like the cephalic, basilic, and median cubital veins in the arm are often used because they're easy to access and large enough to comfortably fit the catheter. In some cases, other veins like those in the neck may be used for more advanced types of IVs. Now, let's take a look at the steps for inserting an IV. I have prepared some videos to show you some simple techniques on IV insertion. On the left photo shows the requisites needed for IV insertion. We have there the cannula, extension tubing, of course gloves, IV starter kit, saline flush, and a Curos cap. Now, let's play the video that I prepared. After gathering the requisites, hand hygiene is required before we begin the procedure. Then, don the gloves. Make sure that the gloves is properly fitted on you. Next is to prime the extension tubing with saline flush, making sure that there is no air left in it. After that, open the starter kit and set aside the sterile transparent dressing and take the tourniquet. Apply the tourniquet 3 to 4 inches above your insertion site. Clean the site with chlorhexidine solution for 30 seconds and let it air dry. Once the area has dried, open your IV cannula. Make sure to check the expiry date and check for any defects. Choose the desired size of the cannula, but in this video, I used a 22 gauge since it's meant for educational purposes only. Consent was given by the person involved in this video. Before you stick your needle, make sure to position your angle 10 to 30 degrees, making sure that bevel is up. Pull the skin to stabilize the vein and prevent it from rolling up. Let the patient know when you're about to stick the needle. While inserting the needle, check for any blood returns. Lower your angle once you notice your good blood return. Retract the needle about 1/8 of the size, then advance the cannula slowly to the vein. Untie the tourniquet and put a pressure at the tip of the cannula to prevent the blood from flowing. Remove the needle and place it in a sharp box. Connect the extension tubing. Aspirate for any good blood return. And flush the cannula gently with 2 to 3 ml of saline flush. Put the sterile dressing and anchor the extension tubing on the side, making it loop like a J loop. Then cover the port with Cura's cup to prevent contamination. On the upper right side of this slide, you could see the green cap is a Cura's cap. Let's move on to the common complications of IV insertion. While IV insertion is generally safe, there are some common complications. First is infiltration. Infiltration happens when the IV fluid leaks into the surrounding tissue instead of staying in the vein. This can cause swelling and discomfort. Next is phlebitis. This is an inflammation of the vein which often causes redness, warmth, and tenderness along the vein. Infection can occur if bacteria enter the IV site, leading to redness, swelling, or pus. And lastly, air embolism. This is a rare but serious complication where air enters the bloodstream, which can cause chest pain or difficulty of breathing. Preventing complications start with using the right technique. Healthcare providers should always use sterile equipment and properly clean the skin before inserting an IV. It is also important to monitor the IV site regularly, checking for signs of swelling, redness, or pain. And finally, using the correct catheter size for the vein can help avoid issues like infiltration and phlebitis. If complications do arise, there are steps to manage them. If infiltration occurs, the IV should be stopped. The arm should be elevated and a warm compress should be applied to the area. If phlebitis happens, the IV should be discontinued as well, and a cool compress can help reduce the swelling. In cases of infection, the IV should be removed and the area should be cleaned. Antibiotics may be needed depending on the severity. In case of air embolism, it's important to position the patient on left side and administer oxygen immediately. To wrap up, IV insertion is a routine essential procedure in healthcare. Although complications can arise, they are generally preventable with proper technique and monitoring. Understanding the process and knowing how to respond can help ensure the safety and well-being of patients. Thank you for watching this presentation. If you have any questions or need further clarification, feel free to ask. I am happy to help.